I'll invite the panel members to come up at this time. Anyways, while they're getting the slides, good morning. I'm Jonathan Weiner. I'm a longtime faculty member at the Bloomberg School of Public Health, and this is an exciting day for me. So to see at this time, at this place, such a fantastic group of people focused on determinants of health, social determinants of health. Obviously, for those of us in the public health domain, before there was a term population health, we've known for a long time that 80% of what matters to health and well-being is really not in the medical establishment. Out of one window in my office is the Johns Hopkins Hospital, arguably one of the best hospitals in the country, certainly the most expensive per square foot when they built it. And any of us would probably want to go there for medical care. If you've ever been to Baltimore, you also know that East Baltimore, if it were a separate country, would be probably about 300th in terms of health and well-being of the population. I think you could probably also say the same thing for informatics and data. I once, I think on this podium a few years back, did some math. Just like 97% of our US healthcare dollar goes to medical care, so does 95% of our informatics dollar. But the exciting time is that if you look at the Gartner curve, we're definitely on a hype cycle on SDH, social determinant of health. What is that? Thank you for a good start at defining social determinants of health. Of course, no two people would agree to that. But basically, it's everything that people spend 99% of their time doing, and that's not seeing doctors in hospitals. It's spending time in their life and breathing air and being humans. And we have a long way to go. Just think 10 years ago where we were at DHRs. Look where we are today. Look around the world where we are with social determinants of health and social factors. I believe that 10 years from now, we will also have that exponential growth curve, thanks to all of you. So when we talk about health and social determinants and population health and public health, I hope during the presentations and the 3 hours that we have, we can discuss that. But we are talking about data, yes, from the electronic health record, although if any of you have ever looked at the social determinant data in the EHR itself, it's only about 5% populated, so we have a long way to go. We're also talking to the consumer, the person, not just the patient, but also the person who 97% of the time is not a patient. Even the sickest person is not a patient most of the time. And Google and the five icons in Silicon Valley have done a pretty good job of capturing everything we possibly can to sell us garbage, mainly, or the kids in their virtual nothingness, billionaires, no offense to all those companies out there. Let's just put 1/20th of the energy to improving health and well-being. My two 20-somethings are doing a startup, so all 20-somethings are doing a startup. But so it's our goal to, and we'll hear from the first set of panel members, I think first comes data, then comes love, then comes marriage, right? But first comes the data, then comes what we're going to do with the data. Here come the data. And in my 30, 40 years career, and always being a data geek, I have never had more data. Our Center for Population Health IT, with Hadi being our head data informatics geek, God bless him, and thanks for putting this together, Hadi. We have never had more public health, medical, social determinant data than we have today. So I think all of us are here at a right time, and we'll hear from some leaders. I think what we'll do, we have 55 minutes total, and I've used 3 minutes of it. But, and we all will agree that we want to have the discussion. So I'm going to, and we have a hard stop at 55 minutes. So probably I will give a 1-minute warning when you hit the 9-minute mark. I assume we'll follow the order of Jason first from the CDC. I also thank you for sending the bios out, but I encourage each of you just to say 30 seconds worth of introducing yourself. Then Mary Ann from the Sequoia Project, then Ross from the Health Information Exchange, Chris, for both Maryland, DC too, or yeah, so where we're sitting. And it is one of the 2 or 3 most complete HIEs in the country. A long way to go, but they've come a long way, so we look forward to hearing that. And Margot from Academy Health, and I think you have a session tomorrow too, so double. So anyways, we have a fantastic panel. I will give you each 9 minutes to make any points you want about how the social determinant data is now coalescing. And then later in the day, of course, we'll move toward deploying it to make an impact. And I encourage you to, in addition to talking about the data, giving your spin, your ideas, agreeing, disagreeing with Bill and I and others, but our social determinants, how do we link the medical, non-medical, the public health, the social? Of course, there's no easy answer, but we're on the way. So thank you very much, and I think, Jason, you'll go first.